comment. This is deeply personal for me. I'm not here for sound bites, but I'm angry and I am frustrated.
MP Todd Doherty and Ellis, MP Ellis, they're both on this opioid epidemic, and the NDP check
to
this out.
declare also a national public health emergency. Can you explain why that hasn't happened? And the reason being is that I also, you've heard me many times, I've met with all of you here on this panel, about the need for a plan and a timeline, and that is not in the renewed Canadian Drugs and Substances Strategy. It was something I outlined in Bill C-216, which was defeated by Conservatives and most Liberals, but that would have provided a timeline. That bill directed government to provide a timeline and a plan. So why is there no public health emergency or national public health emergency been declared?
I think the Government of Canada has recognized that the overdose crisis is a public health crisis. We've used a broad range of powers.
You even said it was a public health emergency, so why haven't we declared it?
I think we've regularly put out that it is a public health crisis and that there are a number of actions, including investments of over $1 billion that have been made in a suite of actions, including evidence-based actions, innovative actions. That's why we have the renewed strategy to help guide us forward, working in partnership with others. And as you mentioned, with the renewed strategy, really looking at investment in a suite of services and supports, and there are specific actions that we have. There's resources that have been associated and announced in budget 2023, and then for timelines associated, there's specific actions that have been taken, like the call for proposals for this.
I love all the buzzwords around, a compassionate approach, integrated, coordinated approach, but that requires a timeline and resources. I'm sorry, but $1 billion isn't even 1% of what we spent in response to the COVID-19 health emergency. So that's why we need to declare a national public health emergency so that we can force everyone to the table and actually develop a plan with provinces, with municipalities, with Indigenous nations so that it's coordinated and a cohesive.
Well, this Conservative MP is, if nothing but flabbergasted. Check it out.
For that.
When
the opioid experiment began, and I'm using the words of my colleague, Dr. Hanley, which was in the text of this motion, what was the original null hypothesis that the government put forward for the experiment?
Could you repeat the question at the beginning?
Yes. What was the original null hypothesis generated for this experiment? We all know it was an experiment. It's never been done before. So in an experiment, you really have an idea of what you want to disprove. So what was it? Or was this just something on the back of a napkin, I guess is the question.
I apologize. I think you'll have to just clarify for me what you're referring to by this experiment.
Yep. Well, it's in the text of the motion that we're debating here today that this is a drug experiment. So what was the plan?
I think the government...
So, was there a plan?
There is a plan. There's a very clear plan that the minister announced on October 30th, which really directs where the government is going, which is the renewed Canadian Drugs and Substances Strategy.
Sorry, I'm just going to interrupt you because you said October 30th.
That's your time, Doctor. I'm sorry. Dr. Hanley, please, for 6 minutes.
MP Todd Doherty, he has a family member. He lost opioids. Check this out.
There's a few things I could start off with. I could answer Dr. Hanley's or reply to Dr. Hanley's comment. This is deeply personal for me. I'm not here for sound bites, but I'm angry and I am frustrated. I've been very vocal and upfront about my family's struggles with this horrible epidemic. I've sat with family members of children, both that are now addicted and in the grips of addiction, but families that have also lost loved ones, young children, teens, to this horrible epidemic. So this is deeply personal. To our guests, thank you for being here. Thank you for the work you're doing. But I have to say, whatever it is that we're doing, it's not working. Ms. Saxe, you even said so yourself. Since 2016 to now, 38,000. Whatever it is that we're doing, it's not enough. I get that you're one team and our provinces and others have to do pitch in as well. It's not working. My colleague talked about the experiment. An experiment is to see what works, what doesn't work, throwing $1 billion at it, and the leading cause of death for 10 to 18-year-olds in my province is overdose. It's not working. What are the rates of diversion from government-funded safe supply? Anyone?
Yeah. So as I mentioned earlier, we are working with all
You
of our.
don't have those numbers.
Mr. Doherty, you took a minute and a half to ask the question, and then you interrupted her before she got into her second
Technically,
sentence.
sir, when I asked the question, it was short.
So, Ms. Saxe, if you have a more comprehensive answer, you go ahead.
What I would note is that prescribed pharmaceutical alternatives builds on medication-assisted treatment. And when we look, and when you speak about diversion, first of all, drug trafficking is illegal. We've been very clear about that. Whether that is for, whether that's diversion of pharmaceuticals that have been prescribed for chronic pain, for medication-assisted treatment, or for prescribed,
Do you have a percentage amount of government-funded safe supply that's being diverted?
we are working with our
Okay.
projects to be able to, they all have risk mitigation programs in place. We are
Right.
looking at seeing
So I'm
what are
just
the
looking
best
for a number.
practices.
I'm just looking for a percentage. If we don't have it, that's easy to deal with. What is the average wait time for recovery, to get somebody into recovery in Canada?
There's not good data across Canada, all provinces and territories, and consistent indicators in that regard.
So, how about, do you have a range? Is it a
can
week,
let you know
2
that-
weeks? Because I can tell you that in my province, it's sometimes up to 18 months or longer.
It's an excellent question, because it's exactly why CIHI, in working with the health transfers that are going in the 200 billions, which include 25 billion in new investments, which includes for mental health and substance use services, that CIHI is working with provinces and territories and with partners to be able to get, work closely with them, work with data partners to refine indicators and better collect consistent data.
Are you familiar with the letter from the 17 leading addictions doctors or physicians? Have you met with that group?
I have not met with that.
Okay. Are you familiar with the letter from November 6th from 42 leading group clinicians with addictions medicine? Have you met with that group?
We have met with a range of experts. We continue to meet with a range of experts, and we are continuing to collect data and evidence to better understand the concerns
Okay.
and make sure that our actions are grounded in evidence. And I think this
get
is what
that,
we have been
Ms.
saying.
Sachs, but I'm specifically asking about the authors of these two letters. Have you met with either of these groups?
We have not met with them
Okay.
as a group.
Okay. So both these groups, they say that safe supply is a nice marketing slogan, but it's not working. It's creating a whole new group that are addicted to opioids. Would you agree with that?
How to choose the right audio apps
Oh,
for you.
I'm sorry.
Which
Siri's listening. Hopefully others are as well. Would you agree with that, that it is creating, safe supply is creating, with what we know, safe supply is creating a whole new group of those that are addicted to opioids?
Prescribed pharmaceutical
All I'm asking
alternatives
is, would you agree with that?
is-
With that statement?
Okay,
Is
Ms.
one
Sachs,
of a range of
there'll be no more
actions.
questions. Take the time you need to answer the question.
Prescribed pharmaceutical alternatives is one amongst many actions. I think it's been clear that we need a range of actions. No single action can be taken and will resolve the overdose crisis in and of itself.
Didn't
It's
answer my
important to have a
question.
suite, and I will note that prescribed pharmaceutical alternatives builds on the evidence, and a strong evidence, which is used internationally and in multiple
can't answer the
countries,
question about-
peer-reviewed, of medical-assisted treatment. But I think it's important to understand if there's
I do understand
medication-assisted
that.
treatment.
Your time is up, and if you could finish your answer, Ms. Sachs, without interruption, then we can move to the next questioner.
Prescribed pharmaceutical alternatives build on a strong evidence base of medication-assisted treatment, where there is a strong evidence base. This is a new and emerging action that's being taken as a suite of action that needs to be closely monitored so that we can learn from it, see and adjust as we need with the evidence and research that we are looking at.
Thank you, Ms. Sachs. Next